there is this notion of a bad trip when it comes to drugs, especially psilocybin and psychedelics. So, how do therapists ensure that patients either don't get a bad trip, or when they get one, how do we ameliorate it or treat it in a way that the patient can still have a positive experience?
Yes. Well, the irony here, Jimmy, is that for many patients, the biggest therapeutic gains come not from having a pleasant experience, but from having a really difficult experience. I mentioned I treated Canada's first 6 patients. Let me talk about a guy named Ray. He was 73 years old. He'd had surgery about 4 years before I met him, and then his cancer came back. And he had big ticket cancer related pain issues. He had seen a number of spots on television about psychedelic therapy where people have transcendent experiences and encounters with God and so on. And he was really looking for that very spiritually uplifting experience that just like he'd heard about on TV. But when he actually and when I hear people express that kind of a desire, I always have to remind them that that's not necessarily the outcome that you're going to have. If we look carefully at the Hopkins research papers, we hear them talking about the fact that the people that have these deep spiritual experiences tend to have the best clinical outcomes. But they do say that up to 40% of their research subjects in their trips had moments of extreme anxiety. And so part of the preparation phase, getting a client ready for this, is to help them understand that they need to expect to run into some negative material if there's negative stuff in there. And so Ray, though he was looking for this great spiritual experience, he ended up spending most of his trip with a really emotionally difficult material. I mean, he had suffered a lot of abuse as a kid, and so a lot of his journey was about him immersed in memories of being a 12-year-old that had been beaten up by his mother and taken to the hospital for his injuries and having to lie to the hospital about how he got them. That's not the kind of stuff that Ray was looking for originally when he chose for psilocybin. But the following day, he reported that he was feeling a lot better, that his depression had lifted. He was able to forgive himself for things that he'd carried inside on his conscience for decades. He'd let go of a lot of guilt that he'd felt. And he said the day after, I'm actually doing pretty good. I feel so much better. There's a lightness today. And I finally found a level of forgiveness for myself. And what I'm seeing is that even the patients that run into really challenging, emotionally painful material in their journeys, they realize that that's what had to come up in order for them to get to a place of better well-being. So much of the preparation, Jimmy, is about helping people to understand that it's okay to feel bad. That is, if my experience becomes one of sadness and loss or anger or bitterness, the important thing is just to stay with that stuff and let it digest. So we're talking about a kind of a digestive process where old negative memories, repressed emotion that has been kind of stuck inside for a long time. This is a process that allows it to be digested or metabolized and turned into something that is no longer toxic to our psychic systems.
So what you said there, I think is very interesting that a bad trip may actually be more therapeutic than a positive, just good feelings. And if you're able to work through them with a counselor or therapist, that might actually be even more beneficial for the healing for that patient. That's interesting.
Yes, that is seen so clearly again and again. It's a seems to be a fundamental paradox about this treatment form.
Right. So you would say that psilocybin, especially in this sort of setting with a therapist in a control setting like this, is safe.
Yes, it is extremely safe when the session is conducted according to a well-researched protocol and done with suitably trained therapists. And without those two considerations, all bets are off.